Hair loss and diabetes.
जो एक मन में मेरे डर था कि नहीं शुगर पेशेंट होते हैं तो उनको शायद ट्रांसप्लांट उनके लिए अच्छा नहीं होता। इन्होंने मेरे को बताया कि आप अपना थोड़ा शुगर को कंट्रोल करो। 11 अक्टूबर को जो ट्रांसप्लांट हुआ था, 3 महीने के बाद में मेरा एकदम ऐसा लग रहा है कि अगर मैं नहीं कराता तो शायद गलत हो जाता वो।
Hair loss can be particularly distressing for the people who have diabetes. Is the solution as simple as undergoing a hair transplant? No, it's not. In this 2-part video, we'll explore the connection between hair loss and diabetes and whether patients with type 1 or type 2 diabetes qualify for hair transplant procedures. We'll also discuss how they should prepare if they do qualify. So let's start the first part. So let's understand the connection between diabetes and hair loss. So consistently high blood sugar levels can harm blood vessels over time. This prolonged exposure to elevated glucose levels can lead to poor circulation, damaging delicate network of blood vessels. As a result, hair follicles may not receive sufficient nutrients and oxygen for healthy growth, causing thinning or even some hair loss. Can diabetics undergo a hair transplant? Well-managed diabetic patients can meet the requirements for a successful hair transplant surgery. However, additional risks and factors must be considered, such as slower wound healing, increased susceptibility to infections after surgery. These emphasize the importance of thorough pre-operative assessments, close monitoring after surgery, and customized care plans to minimize potential risks and ensure the best outcomes. If your sugar levels are not controlled and you are planning to go for a procedure, then you might face few risks or few complications. And these are: first is risk of infection. High glucose levels lowers the body's natural healing process, making people with diabetes more susceptible to infections. Next is bleeding. Surgical procedures carry inherent risks like excessive bleeding. This risk increases for those with uncontrolled diabetes because it impairs the body's clotting ability. Next is delayed recovery. Recovery periods may be extended due to delayed wound healing caused by an impaired immune response from elevated blood sugar levels. It's crucial for patients to discuss their medical history openly with the surgeon before undergoing any procedure to ensure a safe and successful outcome. While diabetes can impact hair transplant eligibility due to slower healing time and infection risks, well-managed diabetic patients can still have a successful hair transplant. So now let's have an insight how to prepare a diabetic patient for hair transplant. This is quite essential to take steps towards optimal diabetes management. And these include: control your blood sugar levels before scheduling the procedure. Get an HbA1c test to assess your diabetes management over 3 months. Mitigate risks associated with diabetes as much as possible. Review all current medications and adjust or stop them under medical supervision if required. And maintain a balanced diet, exercise regularly, get enough sleep, and manage stress levels for optimal surgical outcomes. And very important is quit smoking at least 1 to 2 weeks before the procedure to improve wound healing post hair transplant. Results won't appear overnight, so mentally prepare yourself for the journey ahead. So let's conclude. With well-managed diabetes, it means blood sugar levels are consistently within a healthy range. The chances of being accepted as a viable candidate for hair transplant are significantly improved, and we can proceed for hair transplant in such cases. So wishing you good luck if you have diabetes and if you have known your surgeon well.